glad we have such a small group because I like interaction, and we've already started some of that. So I'm not really tied to this PowerPoint, so if at some point that you have questions that are provoked by it, please let me know, okay? My name is Curtis Jenkins. I am part of the Bureau of Exceptional Education and Student Services, and I'm in the Student Service Office. There are a team of us, school counselors, psychologists, social workers, school nurse, a Medicaid specialist that helps school districts to run those charges, and a coordinator that does a wonderful job at helping us to be a model for schools and school districts in student service supports that we're going to talk about in a minute, that in this case are showing promise for school-based mental health difficulties that are maybe not on the increase, but are being much more, people are much more aware of them now because of certain traumas and tragedies in the community, Sandy Hook being the latest, probably not the latest now. But after Sandy Hook, our office was asked to present to the Children and Youth Cabinet and several subcommittees in the legislature on what kinds of supports were available in schools to help with students that may exhibit some sort of mental health issue. We're trying to reframe it, by the way, that and use more language of social, emotional, and behavioral, because that's really where the difficulty and the solution lie in understanding why students' social interactions and their behavior is the way it is. I'm going to lay some groundwork of a study that was done, and then we'll go into the real meat of what's available within the school system to help students with social emotional issues. So, what are the school-based resources? I started to tell you about our project, and that's only part of it. We're trying to promote also through our project a wide spectrum of assessment, prevention, intervention, and then postvention supports for students in all areas. But today we'll talk about the social, emotional, and behavioral. We're trying to promote also schools to be a safe place, a nurturing place, and a place where they can be engaged and feel safe and be part of their education. And ideally, those should align with the other stakeholders that we call on frequently, community-based folks and other supports, and it should be a seamless system. Right now, and we'll talk about that in a little bit, it seems a bit disjointed and not as effective as it can be. Yeah.
Okay, can we back up here a minute? I think I'm confused. Is this your model that you're working on now, or is this what you're hoping we get to be with our schools? A
little bit of both. It is well established now, and we'll get into the meat of it in a moment. It's a multi-tiered system that is in place to help all students, but add additional layers of support to those students that need more.
Okay. And so, at what level, grade, age would it start?
It would start with pre-K. If the pre-K program is within a regular public school, every public school should have the student services team at every school that I'm talking about today. Now, whether they're working up to their potential is another thing, and that's part of why I said a little bit of both, because it's an ongoing support not just for families, but for them as well.
I'd love to see that work.
So I want to tell you why we're talking about these supports and why schools need mental health. We believe that psychological wellness is an integral part of success in school, and study after study has shown that if a student is feeling good about themselves and safe at school, then they're engaged in school and their progress is much better. There are unmet needs we're going to talk about for mental health services for children and youth. Schools are a natural place, though, to provide these support systems. They're there most of the day. Addressing children's mental health needs is an investment that we need to make, and it's a wise investment because the outcome is much better on this end than it is on the other end when we have to provide discipline services or other punitive services.
But do you, you said, did you go to the Capitol and the Appropriations Committee for education?
That's a tough one because,
and tell them this,
as you know,
that it's cheaper to give this kid mental health services than for you to build a new jailhouse to put him in?
As you know, the legislature's mind now, for the most part, is to save dollars and to give dollars back to the citizens. That's an admirable endeavor, but we need to be smart about where we invest our dollars as well.
So if we don't invest them in the children who are going to one day pick our nursing homes, that's not saving?
We're going to be sorry.
Yeah.
I'm sorry.
The second major bullet on the previous slide mentions the growing unmet need, and I'm curious to know in Florida, do you still need to prove or demonstrate that, or are you at a point where leaders say they acknowledge, yes, we have this growing unmet need?
Almost everyone acknowledges that and I mentioned the presentations after Sandy Hook. That was an eye-opener for the Children's and Youth Cabinet, for the governor, and for the subcommittees in the legislature, because they were not aware of the support systems that are already in place. So that's a long-winded way to say we're gaining ground. People are becoming more aware, but you know that awareness is not nearly enough. You have to be able to put that awareness into practice to make it valuable.
I guess I'm wondering, do potential funding partners cross their arms and say, I don't agree with that? Or are they on board that it's a problem and they're just now looking for the right way to invest?
I don't know anyone that crosses their arms and it just puts up the wall immediately. They may acquiesce to our face and then say something else otherwise, but that's not happening. I think what's happening, though, is that there are a multitude of projects that are presented to them, or ideas that are presented to them, and they have to choose. And I'm not sure that I would like to be in a position to have to make that choice either. I know it's a little, I'm sidestepping the question, but I really think that that's the mentality. I think that they're on board. They know that it needs to happen, but maybe we can put it off for a while.
And build a jail instead.
So let's talk for a minute about the prevalence, okay? Because in the 1980s and 90s, there was a lot of research that talked about the physical and emotional problems that people were having. And they found that those problems were occurring disproportionately in certain populations. And this study, the ACE study, tried to find out why. And some of you may know the ACE study. A large population of a particular HMO. And what they found is of the 44% of the responders, 44% reported suffering some level of sexual, physical, or psychological abuse in their childhood. a significant part of that was domestic violence in the home. This study looked at, and let's take a look at it. They took a look at all of these indicators. Now, this is not the questions that they asked. The questions were designed, and there are 10 couplets of questions in the ACE study that addresses every one of those conditions that you see there. Some serious ones. But what they found is that as your ACE score, and basically you answered yes to the question, you got a point. The ACE score, the greater the ACE score, the greater the incidence of these co-occurring conditions. It's pretty significant. So, you know, a person that has no ACE score would address their life much easier than a person that had a higher score. So across the population, 44% are coming into our school from families that have some sort of ACE score. These are some of the prevalent conditions we found from these various studies. 20% of school-age children are diagnosed with a mental disorder. 1 in 5 met a psychiatric disorder entering into school, by the time they entered into school. Most common, you can see there. And of those are the ones that sort of stick out when you're talking about school population.
Is that like ADHD 7% of the school population?
Right.
Okay.
Yeah. This is a survey that was done, just some more data that shows the prevalence of certain conditions within our school-age population. This is the Department of Education reports over the years. The 2010, 2011, and 2011-12 are separated because bullying and harassment was separated during those years. So you see the largest is bullying and the smaller, redder ones are harassment, but they're lumped together in numbers. But it increased, a little bit of a decrease there, but it's still over the previous years. So now,
Why would there have been why would there have been a decrease? And is it because of the public awareness that
I think
they have?
public awareness and school awareness and some of the recent efforts at intervention.
How are we getting that data though about how many incidents of bullying?
It's reported by the school.
I know, but where is
see
that
your
from?
point.
School or
I'm sorry?
Because I have a lot of people that schools are not taking the bullying reports. You
I know.
know, that's why I'm wondering: is it going down because we put that formal process in place where they have to take action?
It could be, because that's about the time that it happened. Jeffrey Johnson. So let's talk a minute about what we can do about that. There is a prevalence in our population. It's not everyone, but there's a significant number that school people have to address that difficulty. Here are some of the providers within the school system, and I put the ratios to the side. These are last year's ratios, but they're still pretty current. So you see that even the people that are assigned to address social, emotional, and behavioral situations in school, their numbers are such that it is not optimal. But you also see that there are contracted professionals, people we refer to, and unfortunately at times school resource officers. So what are the challenges? Number one, we don't really do systematic screening, and so we're not really aware from the beginning of all of the students that might need our services, which would be, if we knew, prevention services primarily, right? So we'd start with, and you'll see in a minute the model that I'm going to show you. We would start with all students, providing supports for all students, just to make sure that they are aware of social emotional impacts and social emotional interaction. Except for school counselors, most of our student service people serve multiple schools and are assigned by the school districts. That puts us at a disadvantage at addressing systematically these kinds of issues. Unfortunately, limited professional development that has to do with time out of school for personnel. It has to do with, I'm hoping, not school funds, but in some cases it is. I think a little bit of awareness. People choose to take professional development in certain areas instead of maybe being required or encouraged to take them in other areas, like social emotional issues. And there's sometimes fragmentation about approaches between those of school-based personnel and those of community personnel in addressing this whole section. So
Why would that be?
Well, it's because we don't speak the same language sometimes.
Well, yeah, because I know, like, I think I told you, when my daughter was receiving speech and language outside of school, and she was getting speech and language in school, and the lady from out of school wanted to work with the lady in school.
Right.
And they would not allow it, they would not call her.
I know.
You know, and of course I was livid and
That really is unfortunate.
My anger, you know, and I'm like, do you think I pay these people? I have pockets of money. I can pay these people to say this about this child?
I'm hoping that with recent legislation that improves, because they're required now to allow outside professionals to come into the school and work with your children.
And then too, on the mental health issue, I had to get rid of a counselor that the school had recommended because she overstepped her bounds, and my daughter got Baker acted. And she's developmentally delayed, and all I could do was I went running over to Lakeside and trying to get her out. I'm like, she does not belong here. She cannot be here. And they're like, I'm sorry, we have to keep her because all she did was write the letters, I want to kill myself. And it was a stupid letter. And, you know, and they said we have to keep her. And it was from this counselor who was telling her this stuff, and I'm like, oh, you know, she didn't know. I said, did she read your file at all? And she's like, no.
It's unfortunate.
And she was saying the wrong thing to the wrong child.
And then once it's initiated, it has to run its course.
Yeah, I couldn't get her out, and then I took all her medical records over there. I went running with them, and the guy says until she sees our counselor, she has to stay here. Luckily, she didn't have to do a whole 72 hours. They kept her for like 24. You know.
I wanted to go over this fairly quickly because I don't want really to alarm you. You've all got your own stories about needs and supports from the school system or lack of supports. I wanted to set the stage because I really want to talk about this section. These are the support systems that are required to be in place. And as I said earlier, I alluded to, many schools are doing a really good job at this. Many schools still need training and follow through and, I'm sorry.
What is the wraparound services out there?
Well, it could be a number of things, but let's talk about the model first, and then we'll get to it as we go with the gradient. This triangle can be you can think of as the model for the services. Okay, it is a multi-tiered, you can see, system of support. now what many people don't realize is that the primary support system that everyone gets remains for all students. Even those students that, after this problem-solving approach here that I'll talk about in a minute, the team decides, and the parent is part of the team, decides needs supplemental and intensive supports. So, stop it. Stop it. It's the way it's supposed to work.
Tell us what school districts do, and
Yeah.
we'll go there.
Yeah.
Okay.
Please.
In that happy lane.
So,
But I
with
got a
with the
question.
best, okay.
Why would you have that on the bottom instead of at the top?
Why would you have what?
The bottom pieces here that
Circle?
I really
Can't
cannot
read
read.
Okay.
Okay?
This
That you
right
just-
here?
Yeah, that you
Okay.
said,
That is a problem-solving circle, and I'll talk about that in
okay,
just a
that's,
second.
okay. That's, I got you.
And I'm sorry that it didn't show up on the slide. I thought it was
It's a
going to show
pretty
up better.
slide.
The whole idea is that you take the information that you have, and with that information, and it's usually school-wide information on attendance, it's those that are absent a lot, those that have behavior referrals, those are early warning signs, and we'll talk about that more in a minute. Those kinds of system-wide information help us to decide what all students will get. School-wide positive behavior, the pizza parties and all of those, safe and healthy schools, based on the climate surveys that happen with schools every year. Schools are supposed to, part of their improvement plan, use those surveys to improve the school climate and safety. Social skill training. I was a school counselor for 27 years in Dane County, and nearly all of my primary responsibility was whole classroom presentation so that we address the needs of all of the kids in the school. And it was behavior, it was social skills, it was those kinds of developmentally appropriate supports that all students need. And we have social emotional learning. We'll talk about that in a minute with one of the models. How important it is for kids to understand that they are part of the equation, that they're part of being a safe school. So then we take a look. It's how are students doing, and periodic monitoring of students in the school helps us to find students that are having difficulty and then help them with this problem-solving approach, defining whatever problem they're having that may be interfering with their learning, analyzing why it's happening, stop it, analyzing why it's happening, implementing interventions in the classroom, and then evaluating whether they're working or not. And then you go back to the beginning again. Those teams, once a child is shown to need the second layer, which is supplemental support, sometimes called Tier 2, then interventions are put into place, additional interventions are put into place that are above what all students are getting. And it could be small group. You can see there some of the examples. Anger management. School counselors also are a primary focus of these endeavors. But in the most productive schools, or the most effective schools for this approach, the whole team is part of this problem-solving approach. The counselor, psychologist, administration, parent, school nurse on occasion. We've had cases where the children are constantly in the nurse's clinic, and it really wasn't a medical issue at all. It was an avoidance because of some other issue that was happening. Either academic, or it could have been behavioral, a bullying issue. Could have been academic, that they're not doing well in math or reading. Occasionally there are students that need intensive supports. But as I said before, we try not to talk about tiers anymore. We try to talk universal support, supplemental, and intensive, because this is designed to be a fluid system, so that once a student gets these supplemental supports, they may respond to those and do better and only need universal support. So the model is designed that way so that the interventions are based on the student's need and whether they're responding to interventions or not.
What is a good amount of time to spend on learning
Well, that's what I was trying to get at. There really is no set amount of time. It really is up to the individual student and how they respond to the interventions. But I can tell you that once the interventions are put into place, it's a requirement of the school to monitor them periodically. Academic interventions or behavioral ones. Today we're talking about behavioral, but reading is a simple example to take. If a child is falling behind in reading, the same model here, and interventions are put into place, there's required progress monitoring assessments to be done 3 times a year. And parents are supposed to be invited to meetings after those assessments are done to talk about whether a child is on track, improving with those interventions, or whether the intervention is not working for them. The same thing works with behavior.
Does this apply to students that have an IEP as well?
Absolutely, and many people don't know that, even school personnel. This is designed, remember I said all students,
Yeah.
Yeah.
okay? Gone are the days where kids having a problem, you test them and put them to ESE, and then it's the ESE teacher's problem. It's supposed to be that way. I know you're laughing at me. I'm an optimist, and I'm trying to show you that there are people that are on your side. There are people that work this every day, and I want to say it right, on your behalf, basically tell school districts,
Right.
this is the way it should be done, and sometimes this is the way it must be done, because you will benefit as well from this system.
It's just interesting because a lot of the stuff in some, well, all of the stuff in some, I've never seen a
Well,
school district.
and you're good, and I'm glad you brought that up, because these were just set as examples,
Right,
okay?
yeah.
That given the optimum situation, you might separate them this way.
Right, yeah.
Seldom do we have an optimum situation. Okay, so some of these, what did I call it? Supplemental interventions would be moved down here if school-wide they're having difficulty with social emotional issues, is what we're talking about today. Okay, so if system-wide there are a number of behavioral referrals for
Is this part of the mandatory 20-hour course for special needs education and professional recertification?
no,
Because
but it should be.
I think what a lot of us are seeing is we see some of the all, right, some of that. And then under like the intensive, we might have crisis intervention and a BIP.
Right.
But we're not seeing anything in between.
Okay, I mean
They're
that's.
not
Where's
building,
the
they're not
I
building.
understand that.
Where is the accountability as far as DOE?
Well, that's a good question. In Florida, we have local governance, and we were talking before the session started that the primary law gives a lot of authority to the school district. The legislature is simplistic now, and I'm so glad I'm being recorded too, because I'm just waiting for one of my supervisors to see this. Simplistically, the legislature makes the laws. Simplistically, the DOE lays out some implementation or rules and guidelines. But the school districts, by law, are mandated to implement those. So whether you're talking about this
Something that looks like it anyway.
multi-tiered system of support, or whether you're talking about any other law and rules that the DOE have, the school districts have some significant authority to manage that. We do a good job, I think, with key contacts in the school district to emphasize best practices and as I said before, sometimes insist that things are done. Okay? There are a couple of times where I've asked the general counsel's office to help when the district says we've done it this way for a number of years.
For 30 years, and
Our
I'm not
school
changing
board
it.
has decided we're going to do it this way.
Mhm.
They've stepped in and said, yeah, you need to do this. And so it's a little bit more authority than I have. Most of my contacts will listen to me and our team for best practices because they know they will work. And we can say that later on, they will be glad they did, in a nice way, you know what I mean?
So do you present to the administrators and the teachers, or just to one group?
Well, present is a
Okay,
different thing.
I'll say it this way. Are the administrators aware of this as well as the teachers, or is it just something that I've heard over the course of the school period? Well, this was something the county office sent down, and I don't have time to deal with it.
You may get some people that do that, but I honestly think that principals understand and know this system. I think that when you're looking across the state that you'll find some are really good at it and some may turn away from it like you're saying. I don't know. I don't have all of that feedback information, but I suspect that from hearing from parents that you may be right. Our contact is mostly at the district level when we're talking about issues like this, because that person that designates themselves or lets us know that they are the person for us to contact are very knowledgeable. They know it inside and out, maybe not as well as people at the department, but they know the system, and they know their people too, and they know who to call within the district to say, we're going to be in trouble if this goes on much longer. And so we've had a lot of good success with that point person. But no, we
How about
don't.
academic
Very
success?
seldom do I talk to individual teachers, more principals, but almost always the district contact.
No ESE teachers?
Not straight away, no. Not unless they call us with a question.
I'm curious to know, you used the word peer counseling, peer mediation. I'm wondering, especially given the previous session in this room, are there plans to, or maybe you're already doing it, to consider having an official staff position of a peer specialist within schools to be part of this? You know, your previous slide showed the different professionals and kind of the system providers. but I guess adding a peer specialist role, it's something actually we're considering in Nebraska. So this model is kind of interesting, and I'd be curious to know how, if you give any thought to that.
And that's a great idea, because where schools across the country have done that, they've found good success. Someone that knows how to run that kind of program and has a relationship with the kids that will be part of that program. So that's kind of the model. Now let's take a look. We want to engage parents too. So this is a simple way that parents can be involved in this whole process too. We can provide universal supports to parents, mental health, just information basically. Meetings, sharing. There was a session in here earlier that was just a wrap session. But as parents, not necessarily the parents have more difficulty, but they may. There's children that are having more difficulty in school, and we could bump up the interventions to a more from universal to targeted intervention.
It's usually parents bringing in the workshops,
And you're right about that, and there's nothing wrong with that.
such as
Okay.
either CARD or
Right.
National Down Syndrome.
Absolutely. A CARD is a wonderful program. Fiddlers is great. Our SEDNet people, if
They won't
you've
touch anything in our population because they don't benefit from traditional therapies.
No.
well, it depends. It's got to depend on your area then, because I have
Yeah.
heard of it happening.
Some
Okay.
segments are good.
Yeah.
Volusia Flagler area is
Orange County is good to
doing it.
a point. I'll put it like that.
Yeah.
Okay, because with my other child, they did step in and they did help me when the school was trying to put him out.
Now,
And they were
are
trying
they
to tell me.
right? You're right. Are they
clinically
required to
depressed.
do it? Probably not. But
I asked
there
for
are
help.
those that reach out in a preventative way to the general population.
It's not accessible to
What is SEDNet?
I'm sorry. It's the Severely Emotionally Disturbed Network. It's for students with severe
Behavior
Behavioral.
emotional and behavioral difficulty.
Okay, I want to play devil's advocate here and ask this question.
No, really?
I love you too. Okay, and it's about parents. And it says here, parents have consultation with parents about risk behaviors.
Mm-hmm.
Would we not be making a problem where there isn't one?
We could,
Or
but
is it you see a problem and the parent doesn't?
I think I should explain risk behavior, okay?
Okay.
Because
How are you defining
and
it?
some of it is age appropriate.
Okay.
It's not we're going out and just just talking over the children's head, or it's not appropriate. The schools are mandated to help students know about risky behavior, even kindergartners. Usually in kindergarten, it takes the form of you get germs, you need to brush your teeth, you need to wash your hands, that sort of thing. Preventative stuff. There are things out there that can hurt you. As the children get older, the interventions get more age appropriate until you get to 5th grade, where they talk about sex and dangerous activity and things like that, with the ability of parents to opt out of that, to opt their kids out of that. Okay. So all of the interventions, even sensitive ones like that, are trying to be age appropriate.
Oh, okay. Because I was in, I did a thing with the Department of Education a couple of years ago with some ESE administrators and gen ed teachers, and we were doing validating FCAT testing. And they was telling me, they were saying, I have generations of students where I taught the mother, I taught the grandmother, now I'm teaching the grandchild, and these were ESE students. And I'm like, how in the world, you've been teaching that long? She's like, yeah. But the mother, when you have parents that have disconnected from education, okay, who dropped out of school in 9th grade or 6th grade or 7th grade, whenever, and just had a horrible experience and wants nothing to do with it. And I'm looking here, and that's one of my pet peeves, is parents do not go to meetings at school. Unless the kid is getting an award.
That's one of the jobs that we really need to do better at, is engaging parents too. We talked about student engagement a minute ago, how important it is for their improvement. It's essential that we engage the parents better. I mean, come on. Parents, no matter what their level, no matter what their experience, do the best they can.
Yeah.
With what they have to use. And if we can engage them, then they can be empowered by some of the information that we have too.
I think one of the challenges is we don't meet families where they're at.
Yes.
If a family can only give you an hour a month, that's still something. And we expect, oh, you come to this IEP on Tuesday during work from 1 to 5, actually it wouldn't be that, it'd be 10 to 2. If you can't make it, you're not an engaged parent. You know what I mean? But we're not meeting them where we're at and getting them the support they need.
I always see my back with a list. I can meet you.
I know.
The federal law said that you need to, because I've gotten a 3-day notice of an IEP meeting. And I'm like,
Teachers union does not allow them to be outside school
and
hours.
they always want to meet on Wednesdays. The short day in our county for school.
I know.
And I'm like, okay, I can't do Wednesdays. Okay, wrong answer.
So, I do know that the Bureau does try to help them understand flex hours and comp time for teachers, that sort of thing. Whether they're willing to do it or not is another story, but it is possible.
Yeah. But I mean, if we could get the parent to really understand that this will help your child, okay, and I'm going to say this in this room, we're going to go to the ghetto and tell them, okay, we're going to help you with the babysitter so you can go sit on the corner and gossip about somebody else.
Yes.
But you need to come hear what we have to say. And that's really the only way you can get, especially to black parents that don't show up. And like I tell you, my brother teaches in Georgia, and he and I have these conversations all the time about, he says, we set up meetings, they don't come. He says, the kid is tearing up the school. We're trying to help. I want to see this kid, do better.
But I don't want to go to a meeting where the nicest thing I hear is, wow, look how tall your son is getting.
Oh, yeah.
That doesn't make us want to...
No, the one I got when the lady tried to tell me, look what your daughter wrote. And it wasn't even her paper. Like, I was stupid. I'm like, my kid didn't write that. And I still got it to prove it.
I know there are horror stories out there, believe me.
But, yeah.
I hear them frequently.
Yeah, but
What I want you to take away from here is that there is a system in place, and there are people like me that will stand by you and do what we can. It may not be enough either,
Right.
but we will do what we can to get your children what they need.
So how do parents get an idea of what their student can actually receive? We have like this super secret, code word where you get nothing. But, parents need to be able to say, like, this is the spectrum of services or supports, and be able to have an idea, like, what the school administrator actually has in their bag of tricks, so that they know where to go.
I know, and that's another difficult part, because the design of IDEA and individual education plans is individual. And so that in itself makes it difficult to give you a complete range of
Right.
services. And the design is that, and the requirement is that that local team, by law, is responsible for doing for you what needs to be done for your children. It doesn't happen all the time, I know. And unfortunately, the ultimate way to pressure that is litigation. And
Right, but what I'm saying, like when my son took the FCAT, somebody was lazy enough to have the FCAT accommodations book on the desk, you know what I mean? So I could say, actually, no, this is, because they never tell you what's there, this is actually what would work. But if I at least had an idea of what is being provided throughout the state or the nation or whatever, like that hierarchy you were showing, if I had some idea that, yes, some areas are providing peer mentors and social skills groups and stuff like
Right.
that, but if I at least had that knowledge to go in, I'd be able to say, you know, I've heard that such and such has this and it's working.
a good place to start is at the table for the ESE department in the exhibit hall. They've got nearly all of their publications there. The accommodations book is excellent.
I attended to a meeting because they didn't believe something was an accommodation.
See, and
It's in digital form too.
Oh, really?
Leanne Griot is just one of the program specialists in the department that is so knowledgeable about accommodations that, I mean, she could talk to you all day long about possibilities, but it all boils down to when you're meeting with that IEP team. But you're right, I know that when you know what's possible, you can champion for your own kid too.
Because if I go in there having no idea of what exists, I
Don't
have
know
no
what
idea
you
what
have
to
to
ask
ask
for.
I know.
And
I
when
know.
they say, you know, we don't do that, oh, okay.
Well, and
That's the
I guess
first
I
one
would.
out their mouth.
Yeah,
I guess-
We don't,
Will.
we don't do that.
We don't do that.
I guess I would
Yes, you
We
never.
can't do that.
I would never accept that answer, probably. I would. They may not be able to do it, but to say we don't do that is inaccurate, and it should never happen.
Huh, you
It
better send a
should.
memo out there.
A school person should tell you and explain to you why we don't have that. But this is what we do have. And it can work as well or better for your child than this accommodation.
Yeah.
That's the smart answer,
No.
Right.
okay? I can't answer for that other answer that is just blank and let's move on. To me, that should never happen. It should be explaining, it should be a conversation, not a conversation
Because
stop.
I've looked at like evidence-based practice and it's always like links to go here or, you know, that kind of stuff. But like something actually shows like these are the type of things that have been effective. You know, these social skills groups or these lunch groups or, you know, that peer mentor, these have been effective. But if parents don't know, and teachers, because teachers are going to advocate for you too a lot of the time, if they don't know these things work and have worked other places, they can't go to their school administrator and say, I'd like to start a lunch bunch for social
Right.
skills.
And that's part of where their training needs come in. And some of that's going to be, as time goes on, based on their evaluations, the discussion that happens during their evaluations. You probably have heard that those are changing too,
And when it's gonna be
into
tied to their
performance,
paycheck.
student performance and staff performance. And so hopefully the professional development is going to be based on that feedback too. Again, data. You're absolutely right. You need data to make decent interventions. You can slap any one of those interventions on there, whether it's tier 3 intervention, you can slap it on there, but if nobody's looked at whether it would be helpful for your student
Right.
or not, it's probably not going to be.
Do you guys have a list of like what interventions are out there or anything? Because we can't see if
Yeah.
that intervention's effective, we don't know.
Fiddlers is good. The website on one of the handouts you have on MTSS
Okay.
is another good one. MTSS is basically, and you've probably heard it RTI before.
Yeah.
RTI started out as academic intervention.
Right.
Then they came up with the notion of RTI for behavior, RTIB.
Really?
Then they decided that it's much the same. So now the concept is this multi-tiered system of support. MTSS is the acronym. That includes both academics and behavior. Now there are two separate projects in the state, like ours, that work on academics and behavior. So you'll still hear the Positive Behavioral Supports Project will help you with social emotional behavioral supports, and the RTI project will help you with academic supports. But the concept is under the umbrella and really best understood as MTSS. This is really just a problem-solving model, and we talked about it already. What's the problem? What causes the problem of the behavior? Everyone's behavior is based on something. A person needs something, so they behave to get it. Or the person is going away from something or avoiding something. I mean, bottom line, it's that simple. And so, the best interventions want to know what's causing the behavior. It's a behavior intervention plan, basically. I mean, you've done a million of them. Then, once the interventions are in place, are they meeting the need? So it's a loop, like we saw on the triangle. Just another way to. We talked about these already. We're running out of time, and I'll go through these. Universal supports are for everyone. You see there, it focuses on prevention. Okay, we're good at intervention and problems and critical response, but we're not as good at prevention. And if I had time to show you the survey we did on school personnel, you'd see that even they know they're not good at prevention. We need to be most effective, we need some sort of systematic screening at school. It's not to mean that we're looking for a kid that has a problem. We're looking for school-wide systemic things that we can address in Tier 1 or universal.
Can I ask a quick question?
Yes.
It seems like if they screen for mental health, then they're going to be like, see, your child has that. We don't deal with that at this school. We have to move your child to this school.
And that's always a danger with universal supports, and I would venture to say that may be one of the reasons we don't have them as widespread as we do.
Yeah, because my son was
I mean, the universal screening.
One school in the EBD and another school, first grade, the whole RTI process, which was called in 08, from January 3rd to March 24th, he was moved into a new school. It's amazing.
What I would
how fast
suggest
the
is that we need the universal screening. We don't have to make that available to everyone that may make those determinations.
Because now they're in a lockdown.
I wouldn't, right. I would still suggest that we need the universal screenings, but that we take the data and we use it as a unit. We don't disaggregate it and certainly don't give it to all employees, that we use it for system planning and program planning.
Yeah, I mean, I have
And
right now,
not
my son,
a whole bunch of importance.
he would score that he has mental health issues. He comes from a family I fostered as your adopt that he has very high scores on the ACE right there. And I can tell you, but I don't want him in a lockdown school because of it.
No.
I don't want him to throw away child.
No, you want support systems for them in regular education.
I'm begging for it.
Right.
Can't get it. I'm in Pinellas. Never even heard of it. It's right there in Hillsborough.
See, and that's a shame. That's a large school district, and there are some really fine people in Pinellas and Hillsborough.
We just gotta get to
And I'm ashamed that you don't know about this, and
And I'm out
I mean,
for it.
I
go to
can't-
kids, so all of us.
I can't speak for anyone else, but I just am embarrassed that you don't know about it.
I think part of it is we're missing the parent training.
Missing what?
The parent training component. Parents, school districts should be offering training on this.
Yeah.
What is RTI? What is this? What is evaluation? What is 504? If they don't know, they don't know.
I want you to go to the MTS website, because on their website there are just a whole section for parents in different languages.
Right. But if it
And-
doesn't get to them,
I know, it takes the internet, it takes some study on your own. It's not personal
Oh, I'm
like
not worried
this.
about me.
No, I know, but I'm speaking as a collective. It's not like this either, that we can talk about things that happened to me. You know, I feel for you, I know
I wanna give
the
you
way it
notes
is.
about them.
We're out of time.
Okay.
I'm sorry that we didn't finish, but I'm not sorry that we didn't have this discussion too. I think it's as important as finishing a PowerPoint, okay?
We got your PowerPoint.
We can read it.
Early warning systems are basically school data on attendance, behavior, referrals, and they help to track. First of all, it was designed to track high school students who are off track for graduation. But what we found over the years is that you can take those same indicators and bring them down to elementary school. If the child is not in school and has poor attendance, if they have behavior problems, if they're dropping down in their grades, they're going to be at risk. Well, we've gone through those. These are the positive behavioral supports. Those are our sister projects. Please go and just look at them. Another one, and I'm going to finish with this slide, is social emotional learning. How important it is for a school to be sensitive to that. Because what you see here in this graphic is that it doesn't require both sections on the left to have positive outcomes and better academics. You can start small with a caring environment, people that care, well managed, participating with family, and you're still going to have greater outcomes. You can provide training in social competence to students, social awareness. That's part of what I was talking about in those groups I was doing in school, to help kids to understand they can be part of the equation. You're going to get better outcomes too. Imagine what you can do when you put both of them together and have a school-wide social emotional learning environment. I know you've got to go. I'm sorry. I'm available. My cards are in the back. Call me anytime. Just if you just want to talk over things, to stop it. You want to just talk over things, because honestly, it does help. People have come back to me later, and it didn't change the school's mind, okay, but it did help them to feel more empowered and speak up for themselves in the meeting.
All right, so I
All
have
right,
one last
thank
question
you.
for you.
Yes.
It may not apply. Parents are being asked to sign the Medicaid, approval to bill Medicaid.
Right.
And
I
they're
refuse.
always told it's not going to impact your services with Medicaid. You don't have limits, blah, blah, blah. With behavioral services through Medicaid, there is a limit, and it's 140 hours a month.
I know.
And if they're using those in schools, that counts against that allotment.
Part of what I would say to that is, and I'm not the expert on
Right.
Medicaid, okay, but part of the way the school system reports to Medicaid is a I don't know what the wording is, but
Right.
instead of individual services, they provide a collection of services. Or they report a
Right,
collection
they
of
were,
services.
but
Or
now
hours.
But now that ABA's become Medicaid billable, they're billing those individual hours per student.
Okay.
And
They-
that's
and
my,
they send
You
that
can
form
revoke
off
that.
Oh, I
first of the year.
You can
And
revoke
they
that
ask you
signature.
to sign off so they
Yeah,
can
but-
bill.
okay,
their
we're the smart
Medicaid.
parents.
And
We're the
I
smart parents.
refuse.
For specific services?
No.
You have to
No,
sign something?
they send a blank form,
yeah,
okay? That says, you know, whatever services we want to
so
bill,
my
and
worry
we
just
can
is
bill Medicaid
if
for
these
it.
parents are signing, which they're gonna do to make the school happy, honestly.
Right.
And then all of a sudden, they're gonna go to get behavioral service and, oh, you've used all your hours.
You've used your hours, right?
Because they can actually bill for one-on-one at school through behavioral.
And does,
I refuse to give them, nope.
So,
Told
So
them I
the
didn't have, I told
parent
them I
needs to
didn't have
check their
Medicaid.
file and revoke it if they have signed it.
I
Yep.
know, but we're the smart ones.
let me ask you to call Ann Glass in our department.
Okay.
You can use the same number.
Okay,
And talk to Ann Glass, because she's our Medicaid
okay, I'm not, yeah,
school advisor. And she knows Medicaid in and out,
yeah.
and can advise you on strategies working with the school district.
Because I just want to
But
make
is
sure.
it legal though for them to do that to us?
Unless, if
I
you
don't
sign,
know,
If
honestly.
you sign,
I
you
don't
gotta
know.
know,
I
and
refuse
it's
to sign
yearly
it.
now, it's yearly. Every year they have to
If
ask
you
you to
would-
sign.
I know, in the beginning of the school year,
Right, right.
they send you these
Right.
9,000 forms
Right,
and you have to
well, you have
sign.
a right to check your individual's
No.
folder,
And
file.
it didn't used to be a problem because we didn't have
it
the
never
behavioral
happened.
service.
Yeah, I know.
It
I
was-
saw
it was-
it and I was kind of shocked, like, are you kidding me?
Schools, but the idea behind it is schools are strapped.
Yeah.
They need as much money as they can,
Yeah.
and they wanted to be able to collect Medicaid, and they weren't previously.
and if you're not using it